Hello, today is Friday, February 12th, 2021, and this is Dr. Rhonda Johnson. And today I'm going to be talking about children, one of my favorite subjects as a pediatrician. I'm going to be talking about COVID-19 infection rates in children, giving an update. I'm also going to be talking about the COVID-19 vaccination trials in children, giving an update, and the new CDC recommendations around reopening schools. So let's first start off with the update on COVID-19 infection. According to the American Academy of Pediatrics, more than 2.9 million children have had COVID-19 positive tests, and at least 227 deaths have been reported as of February 4th. And again, the pediatric experts say that this is probably a significant undercount of COVID infection in children because many kids have mild diseases. We also know that children can have a rare but serious condition linked to COVID known as multi-system inflammatory syndrome in children. And nationwide, there have been almost 1,700 cases with 26 known pediatric deaths. So parents, please recognize the signs of COVID infection in children. I've done a lot of videos on this, so you may want to check my YouTube channel and get more information on COVID infection in children. Now, as far as vaccinations go in the pediatric trials, the Pfizer vaccine, is authorized for 16 years up, persons 16 and up. It's the only one that has an authorization for youth. And they have announced recently, Pfizer, that their phase 3 clinical trials for adolescents between the ages of 12 to 15 are fully enrolled. That means they have all the children that they need to make a study, and that they could seek authorization for that age group by the first half of this year, which is good news. Moderna, you may recall, their vaccine is authorized under emergency use authorization for persons 18 and up, and they are enrolling adolescents between the ages of 12 to 17 in clinical trials for their vaccine. According to Dr. Fauci, these trials for children will have what's called age de-escalation, where you do a clinical trial with, right now they're doing 12 to 17 for Moderna. Pfizer's doing 12 to 15. And then under age de-escalation, next would be the group that's 16 to 12, and then 12 to 9 years old, and then 9 to 6 year old. And what they're expected to do is test these vaccines at lower doses for younger children. But according to Dr. Fauci, there should be some pediatric vaccines for children by the year end. And the experts at the American Academy of Pediatrics are pushing for widespread COVID-19 vaccination in children. Which leads me to the issue of reopening schools. The experts at the Harvard Graduate School of Education say that there is overwhelming evidence that here in the United States, K through 12 grades, K through 12, kindergarten through 12th grade education appears to be on a downward slide as the pandemic continues. These experts are saying that the students are not showing up as much for their online classes. They're not showing up consistently for online learning, and they're not doing as much when they do show up. They're not engaging in the classroom. They're not as active in their classes. So this is, of course, very concerning because many school districts now have been virtual for almost a year since the pandemic really started here in the United States last year. So the CDC has issued new recommendations for opening schools, and they have adopted what they call a classroom first approach, where schools should prioritize in-person instruction over extracurricular activities, including sports and school events. Well, that sounds like a good plan to me, but that's just my opinion. Now, they talk about how schools are part of communities, and if community transmission is high, students and staff are more likely to come to school while infectious, and COVID-19 can spread more easily in schools. So in short, according to the CDC, success in preventing the introduction and transmission of COVID infection in schools is connected to preventing transmission in communities. That certainly makes sense. So what does the CDC report show? Well, they recommend widespread masking at all times for all children above the ages of 2. They do not currently recommend that schools conduct symptom screening on a daily basis for all grades in K through 12 on a routine daily basis. They also say that parents, caregivers, or guardians should be doing more monitoring of children at home for symptoms of infectious illness. So parents, you've got to know the symptoms of COVID-19 in children. And students who are sick should not attend school in person. Now, they released a lot of documents today, and that included a 36-page COVID mitigation toolkit to help schools plan for reopening, with planning suggestions, checklists, and a comprehensive guide. Some of the specific, I can't go through all the 36 pages, of course, but some of the recommendations included using those physical barriers like plexiglass stations, improving ventilation where feasible, adequate cleaning and disinfection, and PPE, personal protective equipment, for the school staff that might need it, like the janitors, the maintenance staff, and the various staff that are school health staff. So again, there are specific recommendations. It appears to me there's a increasing recognition that children are not doing well in terms of being out of school, and children are falling behind. So there appears like there's going to be a push to get kids back in schools, folks. So parents, you have something to think about. And in the meantime, continue to learn and think and plan so that when it's time to send your kids back to school, you'll be prepared. Learn the symptoms of COVID-19 infection in children. And as always, I say, please take care of yourselves, stay connected, continue to practice prevention, and again, be thinking and making your decision about getting a COVID-19 vaccine. I'm pleased to say I got my first dose of the Moderna vaccine yesterday. I feel fine. A little sore in the arm, but nothing more than what I had when I had the flu shot. So that's it for today. I hope everyone has a safe and pleasant weekend. Until next time, my views are my own, and have a blessed day.